Hello everyone, my name is Stephanie Mullins. Today I will be talking to you about methicillin-resistant Staphylococcus aureus, also commonly known as MRSA. The reason that I chose to do MRSA is because when my cousin was little, she acquired MRSA and it made her very sick. She wasn't able to be around anyone in the family until she was completely healed, being that MRSA is very highly contagious. So, what exactly is MRSA? MRSA is a bacterium that causes infections in different parts of the body. MRSA, however, is tougher to treat than most strains of Staphylococcus aureus or staph because of its resistance to some of the most commonly used antibiotics such as amoxicillin or penicillin. Being that MRSA is so resistant to so many of the most commonly used antibiotics, most people refer to MRSA as the superbug. MRSA is also a gram-positive bacteria. Also, approximately 2% of the world's population carry MRSA inside of them, but they are not technically infected. So, the mode of transmission for MRSA is strictly skin-to-skin contact. MRSA is spread by someone that touches someone who has MRSA on their skin or by simply touching objects that have the bacteria on them. MRSA is a very highly contagious infection, therefore it can spread very rapidly if it is left untreated. There are two populations of people who tend to get MRSA the most. One of the populations being those that are in hospitals or other healthcare environments, or those that simply just get the infection in the community. High school wrestlers are another group of people that are also at high risk of contracting the MRSA infection, being that they are having full-on skin-to-skin contact during their practices and their matches. Staph skin infections generally start as swollen, painful red bumps that may resemble a spider bite. These painful red bumps could be full of pus or other drainage. They may be warm to touch, or you may also run a fever, hence why it is an infection. These painful red bumps can quickly turn into deep, painful abscesses, which is what my little cousin had, and those require surgical draining so that they can be sure to get all of the infection out. Typically, MRSA is not that life-threatening. However, the bacteria can burrow itself into the body, causing life-threatening infections in things such as your bones, surgical wounds, or it can even get in the bloodstream, which is really, really dangerous. MRSA can be an everyday infection that just affects your skin and is easily treated with your common antibiotic or by drainage. Or it can be a much more invasive and dangerous infection that could infect your bloodstream, your lungs, your heart, your bones, or your joints. Although MRSA is resistant to many of the common antibiotics such as amoxicillin or penicillin, there are still some antibiotics that will work to kill the infection. Some of these antibiotics are clindamycin or minocycline. However, if MRSA gets into your bloodstream, you will not be able to use your typical by-mouth antibiotics. You will need to go to the hospital or to your doctor and receive intravenous antibiotics, which is just simply your antibiotic through an IV. Treatment of MRSA at home typically takes up to 7 to 10 days, generally because that's the amount of antibiotics that your doctor will give you. However, antibiotics are not always necessary if you have MRSA. If you have a small MRSA skin bowl, your doctor may just suggest that he make an incision and drain all of the infection out of the bowl. If you are given an antibiotic, please always take all of the antibiotic prescribed, even if you start feeling better, because the virus could be healing up but may not be completely healed, and it will just reoccur if you don't make sure that you finish all of those antibiotics.